Hello and welcome to Health Matters on Channels Television. It's great to have you join us. I am Mary Alale Yusuf. Mortality rate is the number of deaths in a society within a given period of time. Maternal mortality is the rate at which mothers or would-be mothers die within a given amount of time at about 800 per day globally. The World Health Organization says it's just too high. Yet, between 1990 and 2003, the global mortality rate dropped by 45%. 99% of those deaths occur in developing countries, and there's a strong link from them to rural and poorer areas. Adolescent women are more vulnerable than the older counterparts to complications in pregnancy. To look at issues of maternal mortality with us today is Dr. Ayodeji Olamijulo. He's a consultant obstetrician and gynecologist at the Lagos University Teaching Hospital, Idi Araba, a fellow of the West African College of Surgeons, the National Postgraduate Medical College of Nigeria, and also a fellow of the Royal College of Obstetricians and Gynecologists in London. You're welcome to the program.
Thank you.
We say we've had a lot of success. The rate has dropped 45%. That's good. That's a global figure, but Nigeria shares in this success. What are the things that we did? What are the things that were done to attain such success?
Thank you, Mary. The issue of maternal mortality, of course, is a very, very important issue. The statistics you gave earlier, it's an overview of what has happened globally and partly what has happened in this country. Yes, it is true that the fifth Millennium Development Goal was actually to have a reduction of maternal mortality ratio by 75%.
That's 3/4.
Yes, and you have mentioned 45%. Some countries have actually managed to achieve or to attain the 75%
even before
reduction,
2015.
even before 2015. But as 2015 knocks on our door, like you said, unfortunately, we're one of the countries that have not quite managed to do that. I think we've managed to have a reduction of the magnitude of about 30%. So some progress have been made, like you said, but there is a lot more to be done.
But what are the things that we did?
Well, first is that overall there has been a reduction. Increase in awareness about the issue of maternal mortality, but also there has been, to some extent, political leadership, both centrally and also, in the states. But the progress made in this area has been patchy, and also it's not been adequate. For instance, we know that in terms of infrastructures, the Lagos State government, for instance, has opened more health centers, more general hospitals, and so on and so forth.
Okay, that will provide better access.
Exactly. And then there have been places like Ondo State where there's been legislation about reporting maternal death, and also actually taking action also to reduce some of the cost. Also, in Kano State, there has also been some, attempt to reduce cost of providing health care to the individuals. We also have our partners like the NGOs, that's the non-governmental organizations. They've also come in to assist in terms of, provision of things like contraceptive technology, things like will help us to prevent malaria, and so on and so forth. But like I said, it's not enough.
So why are the numbers, that's the rates of mortality, not dropping faster than they have dropped? Because 2015 is around the corner.
Yes.
And we're looking at, 30% that we haven't, no, you said we have 30% success in Nigeria. So we're looking at 40% that we haven't covered.
Yes.
And there's just a few months left.
Yes, I think it's almost certain now that we're not going to meet that target. But we've made some progress, like I've said. I think a former World Health Organization director actually said that political leadership is key. I think in this country until our leaders begin to see the issue of maternal health and maternal mortality, and actually the value of human life as very, very important and crucial. I think we need a lot more commitment in that area. And also, I mean, we know what the causes of death, of maternal death are. We know what can be done, but I think it's a question of putting these things into place within a workable political framework. And of course, we still have the issue of poverty. Serious poverty in the land is hampering efforts.
You said earlier on that the cost has been reduced. When we talk about the cost, are we saying the cost of maintaining a pregnancy, the cost of giving birth? What cost is this?
What I mean is what it will cost the particular woman to access good health care.
Is that still a problem with all the centers that have been opened?
It is still a problem because the fact is that up to 70% of our population live in rural areas. Majority of them live under the poverty line, and therefore, of their own, they need help. They cannot afford what it will take to access, good quality care. And therefore, government, again, like I said, political leadership is key, has to take responsibility for this vast majority in terms of making healthcare affordable.
Okay, you said earlier on that you made the statement, we know what causes maternal death. But some people don't know what causes maternal death. At least they don't know everything. Could you just give us a rundown of the causes, likely causes of maternal death?
The leading causes worldwide and also in this country are hemorrhage, that's bleeding either during pregnancy or in relation to the cause of childbearing itself. Hypertensive disorders, that is eclampsia and pre-eclampsia. Then